Hello, I'm Dr. Hayes Anderson. If you're over 60 and struggling with high blood pressure, I want you to listen very carefully to what I'm about to share. For decades, the conventional medical narrative has blamed salt. Salt is bad, eat less salt, and your blood pressure will come down. But here's the problem with that advice. It only works for about 30% of people. Why? Because salt isn't the real problem. Your blood pressure isn't a simple plumbing issue where higher pressure flows through rigid pipes. What you're actually dealing with is a wall problem. The walls of your blood vessels are deteriorating, and I'm going to show you the 4 hidden mechanisms driving that deterioration, mechanisms that nobody talks about at your annual checkup. Over the course of my 35-year career, I've watched patients follow every piece of mainstream advice: reduce salt, take medications, eat less fat, and still wake up with readings like 160/90. Then I discovered the science behind what's actually happening in their arteries. And when we addressed these 4 mechanisms, something remarkable occurred. Blood pressure numbers dropped 10, 15, sometimes 20 points without medication adjustments. Some patients were able to reduce their medications completely. Today, I'm going to walk you through each of these mechanisms, explain exactly how they damage your blood vessels, and give you the specific interventions backed by peer-reviewed research that can reverse them. Let me start with something most people have never even heard of. It's called the glycocalyx. This is a microscopic layer that lines the interior of every single blood vessel in your body. Think of it like the protective coating on the inside of a water pipe. It's only about 1 micrometer thick, that's 1/1000th of a millimeter, but it's absolutely critical to blood pressure regulation. Here's what the glycocalyx does. First, it produces nitric oxide, which helps blood vessels relax and dilate. Second, it prevents clot formation by keeping blood platelets from sticking to the arterial wall. Third, and this is important for blood pressure, it prevents fluid and electrolytes from leaking out of the blood vessel into the surrounding tissue. When your blood vessels leak, your body compensates by retaining sodium and water to maintain blood volume. That increases pressure. The glycocalyx is under constant attack. There are 2 primary assaults: blood sugar spikes and oxidative stress. When your blood sugar surges, whether from a meal, stress hormones, or poor sleep, it damages the glycocalyx through a process called glycation. This is where glucose molecules bond to proteins in that protective layer, literally cross-linking and destroying the structure. The second assault is oxidative stress, which comes from inflammation throughout your body. Free radicals tear apart the glycocalyx at the molecular level. And here's the dangerous part. Once it's damaged, it takes time to rebuild. And if you keep assaulting it with sugar spikes and oxidative stress, it never fully recovers. Now here's what most doctors don't tell you. You can repair the glycocalyx. There's a specific class of compounds called polyphenols that have demonstrated in multiple studies the ability to restore glycocalyx integrity. The 3 most potent are quercetin, found in red onions, apples, and berries; resveratrol, found in red grapes and red wine; and epicatechin, found in dark chocolate and green tea. In a 2019 study published in the American Journal of Hypertension, researchers gave hypertensive patients quercetin supplementation at 500 milligrams per day for 12 weeks. The result? Average systolic blood pressure dropped by 7 points. That doesn't sound massive until you understand that every 3 to 4 millimeter of mercury reduction in systolic pressure translates to a 6% reduction in cardiovascular disease risk. But you need consistency. The polyphenols must be present regularly to continuously repair the glycocalyx. This is why I recommend my patients consume a polyphenol-rich diet rather than relying on supplements alone. 1 medium red onion contains about 14 milligrams of quercetin. A cup of blueberries contains about 9 milligrams of total polyphenols. 2 squares of 70% dark chocolate contain approximately 12 milligrams of epicatechin. The practical protocol is simple. Every single day, include one of these. A bowl of blueberries, a red apple, a serving of dark chocolate, or a half cup of cooked spinach. Rotate them. This consistent daily intake keeps the glycocalyx continuously repaired. But there's a caveat. You also need to stop the damage. And the primary mechanism of damage is blood sugar spikes. This is why intermittent fasting, which I'll discuss in more detail when I talk about insulin, is so critical. You cannot repair the glycocalyx if you're spiking your blood sugar 6, 7, or 8 times per day. The second mechanism is something I see on imaging scans constantly, and it's almost never properly addressed: arterial calcification. This is where calcium deposits literally harden your arteries, reducing their elasticity and forcing your heart to work harder to push blood through. You've probably heard that calcium is good for your bones. That's true. But calcium doesn't belong in your arteries. When calcium is in the right place, in your skeleton, it makes bones strong. When it's in the wrong place, in your arterial walls, it makes them brittle and stiff. Here's what triggers arterial calcification. There's a protein in your blood called matrix glycoprotein protein, or MGP. This protein is like a bouncer at a nightclub. Its job is to keep calcium out of your arteries and direct it to your bones where it belongs. But MGP only works when it's activated, and activation requires vitamin K2, specifically the MK7 form. Most people are deficient in K2, very deficient. The primary reason is that K2 is found in fermented foods and in the meat of grass-fed animals. Since most of us eat neither fermented foods regularly nor grass-fed beef, we're operating with chronic K2 deficiency. And without activated MGP, calcium freely deposits in your arterial walls. The Rotterdam study, which followed over 4,000 adults for an average of 7 years, found that those with the highest intake of K2 had 32% less coronary calcification than those with the lowest intake. That's a massive difference. And those with the highest K2 intake had 57% lower cardiovascular mortality. Now here's the interesting part. You can't get sufficient K2 from supplements alone because K2 bioavailability is low. You need to eat K2-rich foods. The primary sources are fermented dairy products like aged cheese and natto, which is fermented soybeans. A single serving of natto contains 110 micrograms of K2-MK7. Most people need 60 to 80 micrograms daily for optimal MGP activation. I recommend my patients consume either a serving of natto 3 times per week or aged cheese daily. If that's not feasible, then a high-quality K2-MK7 supplement at 100 micrograms daily is necessary. But there's another piece to this puzzle. Once calcium is already in your arteries, you need to prevent it from worsening and ideally reverse it. And here's where magnesium becomes critical. Magnesium is nature's calcium channel blocker. In the human body, magnesium and calcium work in opposition. When magnesium is adequate, it prevents calcium from depositing in places where you don't want it. When magnesium is depleted, calcium runs wild. Most Americans consume less than 300 milligrams of magnesium daily, and the recommended daily allowance is 400 to 420 for men and 310 to 320 for women. A 2016 meta-analysis of 22 randomized controlled trials found that magnesium supplementation resulted in an average systolic blood pressure reduction of 3 to 4 points. That might sound modest, but when you combine it with the other 3 mechanisms I'm discussing, the cumulative effect is substantial. The dietary sources of magnesium are pumpkin seeds, almonds, spinach, black beans, and dark chocolate. A quarter cup of pumpkin seeds contains 185 milligrams of magnesium. 1 ounce of almonds contains 76 milligrams. A cup of cooked spinach contains 156 milligrams. My protocol for arterial calcification is threefold. Achieve K2-MK7 sufficiency through fermented foods or supplementation. Ensure adequate magnesium intake through diet plus supplementation if needed to reach 400 milligrams daily, and avoid excessive calcium supplementation unless you have documented deficiency. Most Americans get adequate calcium from food. The third mechanism is nitric oxide insufficiency. Nitric oxide, often abbreviated as NO, is one of the most important signaling molecules in your body, particularly for cardiovascular health. It's produced by the cells lining your blood vessels, and its job is to tell the smooth muscle in your arterial walls to relax and dilate. When you have adequate nitric oxide, your blood vessels are like flexible garden hoses, capable of expanding and contracting to regulate pressure. When nitric oxide is depleted, your arteries become like rigid pipes. They can't expand. Pressure builds up. Here's what happens to nitric oxide as you age. Production naturally declines by about half between age 20 and age 60. That's normal. But what accelerates the decline is the combination of high blood pressure, oxidative stress, inflammation, and smoking. It becomes a vicious cycle. Low nitric oxide causes your blood vessels to stiffen. Stiff vessels increase pressure. Higher pressure further damages the endothelium, and nitric oxide production declines further. So how do you restore nitric oxide? There are three primary mechanisms. First, physical activity that creates shear stress in your blood vessels. Second, dietary compounds that boost nitric oxide synthesis. Third, breathing techniques that directly increase nitric oxide in your nasal cavity and respiratory system. Let's start with physical activity. But here's the key. The type of activity matters. I'm not talking about steady-state cardio. That's important for other reasons, but it doesn't produce the shear stress needed to stimulate nitric oxide production. You need isometric exercise, which creates sustained tension in your muscles. The single most effective exercise for increasing nitric oxide is isometric hand grip. You perform this 3 times per week, and it takes less than 2 minutes. Here's exactly how you do it. Using a hand grip dynamometer or even a tennis ball, you squeeze with maximum effort for 2 minutes, rest for 1 minute, then repeat twice more. Just 3 sets, 3 times per week. The research is stunning. A 2016 study published in Medicine and Science in Sports and Exercise had participants perform isometric hand grip training 3 times per week for 8 weeks. The result? Systolic blood pressure decreased by approximately 10 points. That's equivalent to a moderate blood pressure medication, achieved through 2 minutes of exercise 3 times per week. The mechanism is that sustained isometric contraction creates extreme shear stress in the arteries. The endothelial cells lining the vessel walls sense this mechanical stimulus and upregulate nitric oxide production. It's a direct signaling pathway. Now let's talk about breathing. Most people are mouth breathers. They don't realize it, but they're breathing through their mouth, which bypasses the nasal cavity entirely. Your nasal cavity is where nitric oxide is produced. In fact, the paranasal sinuses are like little nitric oxide factories. When you breathe through your nose, the air passes through your sinuses, where nitric oxide is produced, and it travels into your lungs, where it increases absorption of oxygen. The effect is dramatic. In a 2001 study published in the American Journal of Respiratory and Critical Care Medicine, researchers measured nitric oxide levels in nasal breathing versus mouth breathing. Nasal breathing produced 400% more nitric oxide than mouth breathing. 400%. The practical application is simple. During your day, practice nasal breathing. Not all the time, but throughout your day, consciously breathe through your nose. When you exercise, if possible, maintain nasal breathing. Even just practicing conscious nasal breathing for 5 minutes in the morning and 5 minutes in the evening will increase your overall nitric oxide production. The third approach is dietary. Certain compounds are substrates for nitric oxide synthesis. The primary substrate is the amino acid L-arginine, but more importantly, L-citrulline, which the body converts to L-arginine. Watermelon is rich in citrulline. A single serving of watermelon contains 1,000 to 3,000 milligrams of citrulline, depending on the variety. But the most potent dietary source of nitric oxide precursors is beets and beet juice. Beets contain inorganic nitrate, which is converted to nitrite, then to nitric oxide in your blood vessels. A study in hypertension found that a single glass of beet juice reduced systolic blood pressure by approximately 5 points within 3 hours of consumption. I recommend to my patients over 60, perform isometric hand grip 3 times per week, practice nasal breathing throughout the day, and consume 1 serving of beets or beet juice daily, or rotate with spinach, which is also rich in nitrates. The fourth and final mechanism is what I call the insulin-kidney sodium lock. This is perhaps the most overlooked driver of high blood pressure in people over 60. Here's the physiology. Your kidneys are responsible for excreting sodium, but sodium reabsorption in your kidneys is controlled by insulin signaling. When insulin levels are chronically elevated, your kidneys reabsorb sodium aggressively. When insulin levels are low, your kidneys excrete sodium freely. This is why people with insulin resistance and type 2 diabetes almost always have high blood pressure. Their kidneys are constantly in sodium reabsorbing mode. Most people over 60 have developed some degree of insulin resistance, even if they don't have diabetes. Their fasting insulin levels are elevated, usually 8 to 10 or higher, when optimal is below 6. This chronic elevation in insulin drives sodium retention, which drives blood pressure elevation. Now, the conventional response is to restrict sodium intake. But if your insulin levels are high, restricting sodium only makes things worse because your kidneys will reabsorb whatever sodium is present even more aggressively. You're fighting physiology. You need to lower insulin first. There are 2 primary interventions: intermittent fasting and resistance training. I'll start with intermittent fasting. The specific protocol I recommend for patients over 60 is a 16 to 8-hour intermittent fast. This means you eat all your food within an 8-hour window and fast for 16 hours. A meta-analysis of randomized controlled trials found that intermittent fasting reduces insulin levels by an average of 25% over 12 weeks. Think about that, a 25% reduction in insulin. That's transformative for the insulin-kidney sodium lock. The mechanism is that during the 16-hour fasting window, your insulin levels drop significantly. Your pancreas gets a rest. Your insulin sensitivity improves. Your kidneys begin excreting sodium again. After about 4 to 6 weeks of consistent intermittent fasting, patients typically see blood pressure reductions of 5 to 8 points. Now, there's a right way to do 16-8 fasting and a wrong way. The wrong way is to fast for 16 hours and then consume processed food and refined carbohydrates in your 8-hour eating window. That defeats the purpose. You need to eat whole foods emphasizing protein and healthy fats during your eating window. You want stable, moderate insulin spikes, not dramatic ones. A typical protocol would be stop eating by 8 or 9 in the evening, sleep, and resume eating at noon or 1 in the afternoon. This is naturally aligned with your circadian rhythm and makes the fast psychologically easier. The second intervention is resistance training. This is strength training using weights, resistance bands, or body weight. A 2018 systematic review found that resistance training reduces insulin levels and improves insulin sensitivity, independent of weight loss. Participants doing 3 sessions of resistance training per week for 12 weeks showed a 25% reduction in fasting insulin. The mechanism is that muscle tissue is highly sensitive to insulin signaling. When you create micro-tears in muscle tissue through resistance training, those muscles become ravenous for glucose and insulin. They're pulling glucose from your bloodstream, which reduces the amount of glucose remaining in circulation, which means your pancreas doesn't need to secrete as much insulin. I recommend to my patients over 60, combine intermittent fasting with 2 to 3 sessions of resistance training per week. The combination of these 2 interventions addresses the insulin-kidney sodium lock directly. After 12 weeks, most patients see fasting insulin levels drop from 8 to 9 down to 5 or 6. Blood pressure typically drops 10 to 15 points. Now, I've given you 4 separate mechanisms, but the power comes in addressing them simultaneously. Let me give you a practical, integrated protocol that you can implement starting today. Morning. You're in a fasted state. This is perfect. Drink 16 ounces of water with lemon to hydrate and stimulate stomach acid production. Perform your 3 sets of isometric hand grip for 2 minutes. This morning, exercise is done on an empty stomach and will stimulate nitric oxide production throughout the day. Perform 5 minutes of conscious nasal breathing. Throughout the day, maintain nasal breathing as much as possible. If you're sedentary, take a 10-minute walk at noon to continue the sheer stress stimulus. Drink at least 64 ounces of water. Eating window. Beginning at noon or 1 in the afternoon, consume your first meal. This meal should contain protein, healthy fat, and vegetables. Avoid refined carbohydrates. Include a serving of vegetables with each meal. Your first week, rotate through red onions, blueberries, and dark chocolate to ensure polyphenol intake. Your second week, include a serving of beets. Your third week, include aged cheese and natto to ensure K2 intake. Consume pumpkin seeds or almonds daily for magnesium. Supplementation. 100 micrograms of K2-MK7 if you're not consuming fermented dairy and natto regularly. 400 milligrams of additional magnesium in the form of magnesium glycinate taken in the evening. Optional but beneficial. 100 milligrams of quercetin daily if you're not consuming adequate red onions and apples. Dinner. Your last meal should be completed by 8 or 9 in the evening. This allows your fasting window to extend 14 to 16 hours overnight. 3 times per week, perform resistance training. This can be bodyweight exercises like squats, push-ups, and lunges, or it can be weight training at a gym. The goal is to create muscle tension and micro-damage that stimulates insulin sensitivity improvement. Resistance training should last 30 to 45 minutes and should include both lower body and upper body movements. 3 times per week leaves adequate recovery between sessions. Sleep. Sleep is critical for blood pressure regulation and for recovery from exercise. Aim for 7 to 9 hours of consistent sleep, going to bed and waking at the same time each day. This stabilizes your circadian rhythm and improves insulin sensitivity. Stress management. Chronic stress elevates cortisol, which increases blood sugar, and insulin, which worsens the insulin-kidney sodium lock. Implement a stress management practice, meditation, yoga, journaling, or time in nature. Just 15 to 20 minutes daily makes a substantial difference. Home blood pressure monitoring. Begin taking your blood pressure at home. Purchase a validated home monitor. Measure first thing in the morning before eating, and in the evening after your eating window. Record these values daily. You'll begin to see patterns. You'll understand how specific foods, exercise sessions, and stress affect your individual pressure. Now, when can you expect to see results? This is important because patience is critical. Week 1 to 2, you'll begin the fasting and exercise protocol. You may feel slightly different, but your blood pressure won't change much. Don't be discouraged. Your body is adapting. Your insulin levels are beginning to decrease. Your muscles are beginning to develop sensitivity to insulin. Week 3 to 4, you'll likely start seeing small decreases in your blood pressure readings, usually 1 to 3 points. This is encouraging. Continue with the protocol. Week 8 to 12. By this point, if you've been consistent, you should see meaningful reductions. Most patients see 10 to 15-point reductions in systolic blood pressure. If you're on medications, this is when you should be discussing with your doctor the possibility of reducing dosages. Never adjust medications on your own, but these results give you and your doctor data to work with. Week 12 to 24. The changes continue. Some patients continue to see improvements up to 6 months. The mechanisms are compound. As your insulin improves, your kidney function improves, your arterial flexibility improves, your nitric oxide increases, and these improvements feed back into each other. Let me be very clear about something. I'm not telling you to stop your blood pressure medications. If you're on medications, continue taking them as prescribed. What I'm telling you is that these 4 mechanisms are the actual drivers of your elevated blood pressure, and addressing them gives you the best chance of improving your condition, potentially reducing medication needs over time under your doctor's supervision, and most importantly, actually solving the problem rather than just managing symptoms. The pharmaceutical industry will never fund research on polyphenols and K2 and isometric hand grip because there's no patent, no profit. So this information doesn't make it into mainstream medicine. But it's real. It's documented in peer-reviewed literature, and I've seen it transform dozens of my patients' health. Your blood pressure problem is not a salt problem. It's a wall problem. The walls of your blood vessels are damaged because the glycocalyx is destroyed, calcium is deposited, nitric oxide is insufficient, and your kidneys are locked in sodium reabsorbing mode by chronic high insulin. Address these 4 mechanisms with the protocol I've given you, be consistent for at least 12 weeks, and measure your progress with home blood pressure monitoring. I'm confident you'll see meaningful improvements. I'm Dr. Hayes Anderson. Thank you for watching.